If you wake up feeling stiff and achy and you think, I should stretch a little bit to get going this morning, or even worse, by the time I get into my day, I'll be fine, I'll just walk it off. So if that's you, here's something that might surprise you. Stretching and walking it off are possibly two of the worst things you can do for morning stiffness. In this video, I'm going to show you exactly why that might be, and also what your nervous system needs to make sure that your mornings feel free, easy, and mobile. So probably one of the key things we need to talk about first is to understand why the nervous system is important here. Well, firstly, the nervous system has a variety of different ways of receiving information back from out in the body and making sure that going through a process, checks and balances, making sure everything is working properly. So when it comes to mobility and freedom of movement, there are lots of tissues that are going to send information back to the brain. One easy way I like to conceptualize this with clients is talking about a map analogy. So if you think about a map and your brain knows how to get to every place within that map. So from the center out to the edges of that map, if you think about it on an iPhone. Now, when we stretch, for example, what we're essentially saying is we're going to take you off that map. We're going to exceed the limits of that map. The problem with that is, and the reason why you keep getting tight, is you have poor muscle or joint control for a variety of reasons when we go off the map. So the brain, the nervous system, will continue to bring you back onto your current map, the current size of the map. So what we really need to do is we need to increase the size of your current map. The bigger the map, the more the brain can see and control, and the easier it's going to be to maintain that range of motion so you're not waking up stiff and sore. So if you are really stiff and tight in the morning, that's your nervous system's way of saying, right, we need to reduce the range of motion because what we had access to yesterday was not working for us. So if it's a protective mechanism, passive stretching, where we get into a stretched position and hold it for a few seconds to maybe even a few minutes in some cases, is not going to change things neurologically, particularly for the long term. We might get short-term changes for a few minutes or hours here or there, but we're not going to change anything for the long term. And that's what we're really after. That's why we're watching this video, hopefully. So to do that, to get those long-term changes, we need to look at the control systems that determine where the tension sits, and that is your nervous system. There are a variety of tools that we can use to assess and implement change in the nervous system, and those are the muscles themselves, the joints, the fascia, which is the connective tissue, either myofascia, so muscle fascia, or the connective tissue of the skin. The eyes have a massive input into all the information coming in from the world, and that influences the tension within the muscular system. The inner ear and the skin as a somatic system, so the touch of the skin can have a huge impact. I've seen changes in people's knee flexibility, just for an example, where we just deal with skin touch and the knee opens up quite a few degrees with relatively no effort at all. So those are all things we're going to look at in a second. Before we go too much further, if you're like this, you feel like this could be something that's really useful to you and your body, then consider signing up to the newsletter, which is in the link in the description below, for weekly-ish newsletters that will help move you forwards with some of this nervous system work. Here's where we're going to get into some of the action items to actually start improving what's going on with the nervous system. Now, clearly in this video we can't cover everything to do with the nervous system, but I'm going to give you some of the big hitters, start to give you the basics of some of the key systems that fire a lot of information up into your brain. So the first one we're going to look at is the diaphragm, or the respiration generally. So if some of your stiffness comes from the thoracic spine, lumbar spine, pelvis, lower back, then this is going to be really useful for you. So what I want you to do is cross your arms across the chest. We're going to go down into flexion here. So we're going to flex that thoracic spine. We're actually going to improve the muscle function here of the diaphragm and some of the other respiratory muscles. So we're going down into flexion. We're going to rotate to the left-hand side and we're going to tip to the left-hand side. Then what I want you to do is push your belly out as much as you possibly can, like really push your belly forwards, okay? Then once you're there, breathe in on top of that. And relax. Let that go. We've really shortened up the diaphragm there as much as we can in that in this posterior left-hand side of the diaphragm. We're going to flex again, we're going to rotate to the right and we're going to tip to the left, and then we're going to push the belly out as much as you can and breathe in. And then we're going to repeat the same on the right-hand side for the back right and the front right. So that is flex down, rotate right, tip right. Do the same process. Flex forwards, rotate left, tip right, okay, and that will cover your right hand side. So the vagus nerve is the next thing we're going to look at. The vagus nerve is a critical element of the nervous system because it's one of your cranial nerves, okay. It has a lot of information coming back through the digestive system for one, but also through things like your pulse, your heart rate, picking up information around muscles of the eyes, and particularly in other people as well. So when, for example, when someone smiles at you, that can give you a nice relaxed, calming sense to the nervous system. If someone scowls at you, it will do the opposite. And create a slight stress response. So we're going to use your pulse to start to have good inputs into your nervous system to try and ramp up some of that nice information into the nervous system. So the easiest place to do it is probably on the wrist. So we'll try and find the pulse there. Now what you want to do with this one is you want to make sure that you're not feeling the pulse in the left wrist through the fingers on the right hand. You want to use the fingers on the right hand to apply pressure, but try and connect with the pulse in the left wrist and the left arm. So that information is coming up through here, as opposed to you feeling it like it's an external thing that you're feeling. We want to feel it internally in our body, okay? So we can do a couple of minutes feeling the pulse here, a couple of minutes here, couple of minutes here, and also a couple of minutes on the other side. And what that's doing is it's helping to give us a calm nervous system effectively. So when we start to get into a fight flight state, we're losing some of that vagus connectivity. So we're bringing ourselves back into our body. Okay, like I said, vision. It's a huge one, so much information coming into your brain through the eyes. So what's very, very common is the muscles that control the eyeball are very often dysfunctional, particularly when we've got that morning stiffness, maybe stiffness around the neck and lower back again. So what we're going to do is we're going to do some movements of the eyes. Without moving the head, we're going to look up towards the sky. Whilst you're there, you're going to breathe out fully. Come back to the center, breathe in, look down, back to the center, breathe in, look to the left, back to the center, breathing in, to the right, breathe out. And then we want to repeat the process, so up, down, left and right. We want to do that with an in-breath as we do it. So looking up, breathing in, back to the center, let the breath go, and then repeat down, left and right with an in-breath. Again, what we're trying to do is we're trying to not only use the muscles, but use the sensory element of those muscles and upgrade the information coming in through those sensory elements. And as you do that, as the nervous system starts to relax, we're going to open up and we're going to find that the body freely, naturally increases its range of motion because the control systems are in a better place. Okay, so skin touch. This might be really obvious if we think about massage as an example. So when we go to have a massage, we come out and we feel better. We either feel more relaxed generally, or we feel more range of motion, and stiffness that we had going in is somewhat less. So one of the positive influences of massage is the somatic or the skin touch element, like I said. So this is also helping us to come back into our body. So if we're stressed a lot and we're sort of running on adrenaline, we can get very much caught in our head. So by getting in touch with the body, we're sort of bringing ourselves back into the body as opposed to stuck in our head. So if there's an area that you're particularly focused on with regards to stiffness, what we can do is we can just use a bit of light massage, like, so we're not pressing at all, we're literally just running the hand over the skin, and that can have a really positive impact on that area of itself. Now I would advise you cover the whole body, so all the way up the wrists, across the chest, abdomen, back, as much as you can reach, down the legs, etc. That could take you 2 minutes to do pretty much the whole body. Be conscious of where you are when you're on the body, i.e. feel what's going on in the skin. You don't want to be thinking about what you've got coming up later in the day whilst you're kind of just mindlessly kind of running through the skin there. You want to be involved in the process. And the last area, which is still a very important area, is the vestibular system, the inner ear. Now the inner ear also relates to a lot of joint related stiffness and aches and pains. So for this, we're going to close both eyes. Now, if your balance is a challenge, you might want to do this holding on to the back of a chair or a wall, something like that, just to make sure you're not going to fall or stumble over. So holding on to something, potentially both eyes closed, and then we're going to rotate all the way to the right 3 times. Open the eyes, just relax for a second. Close the eyes, rotate to the left 3 times. Now, why this is influencing the vestibular system, the inner ear, is because you have 3 canals in the inner ear. And as we run through a range of motion with the head, the liquid that lives within those canals is having to move and brush past lots of tiny little hairs in there and sending off lots of information to your brain. So as we do that, we're influencing what's going on in one of those canals. We're going to look at the other 2 now. So we're going to rotate the head about 45 degrees, eyes closed, and we're going to come down as far as you comfortably feel you can go. Okay, do that 3 times, open the eyes, just relax for a second, and then rotate 45 to the other side and go down again between the legs. And then we can do the same thing coming backwards. So like so. And then also rotating the head to the other side and doing the same process. 3 reps, open the eyes in the middle, in between sides, and just, calm yourself and make sure that you're happy and you're balanced. So those are some of the key areas that the nervous system is receiving information from, and by upgrading the information that's coming in, we're going to have a much freer, more mobile body as a result. So what you should do is have a little assess, see how your body feels right now. So you might think, you can't touch your toes, so how far can you get down? How far can you rotate the body, etc. Do some of those drills over the next few mornings and see how the body opens up as a consequence. If you want to have a look to see how your nervous system is doing, then I have set up a scorecard which is in a link in the description below, and you can take an assessment and see how your nervous system is performing, and you get a personalized report off the back of completing that. Thanks for watching, and see you again soon.